last week and the week before, cardiac and GI was covered. So I want to take this week to kind of group everything together and to summarize some of it. And in that, I'm going to tell you some test taking strategies and some way when you're studying how to study. All right. Okay. So let's look at this question first. So this question reads, a client is admitted with infective endocarditis. Which finding would alert the nurse to a complication of this condition? Is it dyspnea, heart murmur, fatigue, or fever? So one of the things that you guys can do, you can, in the chat box, you could put your answer, or you could go into the annotates and check mark which one you think is correct if you do not feel comfortable saying the question out aloud. Yeah. What do you guys think?
Well, I'm gonna tell you how I'm thinking about the question. Mm-hmm. Anytime I see itis at the mm-hmm. end of anything, I always mm-hmm. think of infection. Mm-hmm. And what goes along with an infection. Obviously, this is the infection of the lining around the heart. I think of what goes along with infection: fever, swelling, redness. Okay. So immediately, actually, complication. You see, sometimes you gotta look at the complication of the. Okay.
I like that.
Yes. Mm-hmm. Yep. Mm. Okay. So complication of this condition.
What do you think, Olaniki?
I think the answer should be, is it A?
A, all right, noted. All right, what do you think, Jeremy?
Yeah, I was that was actually something that I just about to tell you, A, because complication, of a heart condition. I'm just gonna go with A, yeah, but.
All right, so here is a way to look at this, and it's the same thing when you're in the NCLEX. All right, so it asks for complications, right? Mm-hmm. So this person have endocarditis, and because of the endocarditis, what can occur secondary? That's what it means. Mm-hmm. This is a symptoms. Dyspnea is a symptoms. Wow. Right? Fatigue is a symptoms. Fever is a symptom. The only thing that's not a symptom here, a sign or symptoms, is heart murmur. Heart murmur within itself is a complication.
Oh, wow. Yeah.
All right. So that's one way you can look at it. And it's not that the person will have fever. That's correct. The person will be fatigued with endocarditis. That is correct. But it asks you which finding would alert the nurse to a complication of this condition. And a complication is heart murmur. Other things are signs and symptoms. All right.
Okay.
So I wanted to, what did I do? You guys can't see my screen, let me say. Here. Okay, so with that, I wanted to summarize endocarditis. So endocarditis is the inflammation of the lining on the inside of the heart. In addition to that, it affects the valve. So it builds like vegetation on the valves, all right? It occurs mostly with people who are IV drug users or for people who have valvular replacement. In this case, in the question, this could be a patient who had any of the following that ends up having endocarditis, but these are some of the causes. A port of entry, how the heart or the valves or the endocardium get infected. It could also be that something from a cavity or a cavity. like for someone having a procedure, that's some oral dental work and then gets down into the body. So they will have fever, you can see, they will have anorexia, they will have weight loss, they will have fatigue, cardiac murmur, failure, and embolic complications from the vegetations. Because remember, I tell you that on the valve of the heart, it builds up vegetation, looks like things building up on the valve, which can then break off. Here's one of the things I want you to do when you're looking at these things. If the person may have fever, your treatment would be taking care of fever. So you give Tylenol, you're going to expect that Tylenol is going to be given. If the person have anorexia, remember that anorexia is different from anorexia nervosa. Anorexia nervosa is when they look in the mirror and they think that they're big when they're actually skinny. Anorexia is a loss of appetite. So if they're going to have a loss of appetite, if they're going to have weight loss, then nutrition is important as a nursing intervention. Fatigue, you may want them to rest. Now, when someone have a murmur, imagine on the valve has vegetation and they have a murmur. You have the vegetation that can break off and then cause emboli in the body. So when you talk about emboli, it can go to the kidneys, it can go to the brain, it can go to the lungs, it can go anywhere. In addition to that, it can cause heart failure. And we talk about complication already. So whenever you see what, and do not wait until you see the interventions written out. Once you see what the problem is, you should be, it's like chess. You should be thinking, okay, then if they're going to have fever, I may need to give Tylenol. If they have emboli, it's a possibility they can have emboli, then I may put umbilical stocking on. I have to monitor for respiration and so forth. So know what your intervention will be because of what the problem that can occur. All right. So home treatment, again, if the client, instruct the client to monitor if they have any IV catheter for signs and symptoms of infection. Because remember that they say IV drug use can cause endocarditis. So even if they have a catheter in to get infusion through, it can cause it too. Ask them to assess for temperature up to 6 weeks. They need to check their temperature and report if they have any fever. In addition to that, oral hygiene, because we say that when someone go to do any dental work, and what can occur, you can have microorganisms enter the body through the oral cavity. So again, brush teeth with soft toothbrush and rinse well. Irrigate the mouth, floss to avoid any kind of bacteria. So the client, because one of the most serious of all complications is the emboli, because once that vegetation breaks off, then it can go anywhere. It can go in the spleen, it can go into the brain, it can go to renal, it can go to the anywhere. So that's one of the complications that you want to monitor for. All right. Here is what I tell students. If you look at this question, right? This question gives you two kinds of diseases. It tells you about infective endocarditis, and it tells you, and in the answer, it tells you about murmur. When you're studying, if you do not know what a heart murmur is or how to identify it, do not move on to the next question. This is what a student does. They're doing a test, and they do the test and they see endocarditis. They don't know what it is. They see heart murmur. They don't know how to identify it. And when they're doing the remediation, they move on because they get it correct. Here's what I say. Do not move on. Stop. When you're doing a remediation, stop and look. Okay, I don't know heart murmur. Let me look it up. The reason being is that if you look up heart murmur at this point, if you should look it up again anywhere else, you don't have to look it up again because you already find out the information about heart murmur. So this is the same concept that I'm applying here. This is one question I discussed just now about endocarditis. Now I'm going to talk about murmur. So if you should see that question again, you should have no problem answering it. This video about murmur is also on the platform. So murmur, heart murmur is a distinct sound distinguished by their pitch and their long duration. So most of the time, it is either caused by endocarditis, or if there's a stenosis, which is a hardening of the valves, or there's a regurgitation, meaning that it doesn't close properly. So it's either there's a regurgitation, it doesn't close properly, or it's a stenosis that it doesn't open properly, or vegetation, as we mentioned. So all of this can cause a heart murmur, which is a distinct heart sound. What it does is that you can hear the turbulent blood flow through the valve. All right. So here's what is important to know where you put the stethoscope to hear the heart sound, because when it comes on to murmur, they're going to ask you, is it a systolic murmur? Is it a diastolic murmur? Is it a stenotic, aortic, or mitral valve? So you see that one question that has heart murmur inside there. If you don't know it, you need to stop, or after you finish your test question, and look up murmur, because there's so many questions that can be asked. So this is, you place the stethoscope second intercostal space to hear the aortic. For the aortic, and this is right to the sternum. So this is a right of the sternum. To hear the pulmonic, you place the stethoscope left of the sternum to hear the pulmonic valve. Then you have the tricuspid valve, and you have the mitral valve. The mitral valve is the fifth intercostal space, and that's left mid-clavicular line to over the left side, right? Knowing these are good, because this is how you're going to identify, is it an aortic stenosis? Is it a mitral valve regurgitation? And remember, when you hear the loop-doop sound, it is a closure of the valves that makes the sound. When you hear loop-doop, it's a closure of the valves that make the sound, all right? So when you hear a murmur, of course, we're talking about the valves. So let's look at this. There is a mitral valve regurgitation. And remember, in the first slide, let me go back right here. In regurgitation, what happened is that, look at here, instead of the blood going out, it's dripping back into the ventricle. So it's coming backward. That's regurgitation, right? In stenosis is the opposite. It's hard. The blood cannot go in because it is so hard to open. Right? So keep that in mind. So how do you know if it is a mitral valve regurgitation or it is an aortic stenosis? Now, there's an acronym that is used that is called Mr. Ass. Mr. Ass, yeah, Mr. Ass is an acronym to use to know what it is. Look at this, mitral regurgitation, MR. MR, right?
Yep.
In this, aortic stenosis, AS. And this S stands for systolic. All right. So let me say it again. What causes a murmur is either there's a regurgitation, meaning that the blood is trying to go up, but it comes back down, regurgitation, or stenosis. It's trying to go up through the valves, but because it is so small, it's hardened, it cannot go up. So it's either a stenosis or it's a regurgitation. In addition to that, they're going to ask you, is it systolic or is it diastolic? Systolic occur when the heart is contracting. And what they want to know is there a murmur when the heart is contracting, or is there a murmur when the heart is relaxing? All right. I know this is intense, but it's good for you guys to know because they can ask some of these questions. So Mr. Ass is the acronym to use. Mitral valve regurgitation, or it can be aortic stenosis, and it happens through systolic. So look at this. In mitral valve regurgitation, you're going to hear a murmur that is pansystolic. meaning that you hear it through systolic. Once they say that you hear it through systolic, they're going to say, where do you place the stethoscope to hear it? But remember where the mitral valve is. The mitral valve is the 5th intercostal space, mid-clavicular line. So let me say this again, because I know this can be very difficult or, hard to understand. If they say, I hear a murmur at the 5th intercostal space, mid-clavicular line, it's going to be here, mitral valve. Now, as mentioned, most of the time it will radiate to the underarm pit. Underarm, which is the axilla, they will have a loud blow or high pitch. So how would you know if it is mitral valve regurgitation? You know it's mitral valve regurgitation because it says that you hear it at the apex of the heart. Not only that, you know it is systolic because it said that it is pansystolic or holosystolic. So I know that it happened in the systolic area. Not only that, it is a loud blow, it has a high pitch. So how do I know if it's aortic stenosis? I'm going to do this. Look at this. Aortic stenosis, you hear it, 2nd intercostal space to the right side of the sternum. So that means if they say that a mid-systolic clip, I know it is systolic, the murmur is best heard on the 2nd intercostal space to the right of the sternum. I know it's aortic. It radiates to the neck. Look, it's closer to the neck. This is the 2nd intercostal space. And I know it's systolic because it says you're a systolic click. All righty. That's a mouthful. How do you know if it's a mitral valve or an aortic valve? It's because it's where you place the stethoscope to hear the sound. You place the stethoscope, 2nd intercostal space, and that is right of the sternum to hear the aorta. For the mitral valve, you place it 5th intercostal space, mid-clavicular line to hear the mitral valve. All right? Now, for murmur radiates in the aortic area, it radiates to the neck. Mitral valve murmur radiates to the underarm, right? All righty. So let me ask you a question. I don't have any. Where would you place the stethoscope to hear the mitral valve sound?
The 5th intercostal space, left mid.
By the left side.
Yes, mid-clavicular line. Great. So the question will tell you, they will say the nurse heard a murmur at the 5th intercostal space or right side of the sternum, 5th intercostal space. What kind of murmur it is? That would be a mitral valve murmur. But if you said that, if the nurse placed the stethoscope, set 2nd intercostal space, and that is right side of the sternum, what would that be?
That would be
Can you repeat that question?
If the nurse placed the stethoscope, 2nd intercostal space, right side to the sternum, what are they hearing? What sound is that? Which valve sound is that?
Is it pulmonary or?
I think that one is aortic.
It is aortic.
Okay.
Aortic. So this is what I say.
Oh,
American.
Okay,
American.
Right. Okay, sorry.
There's also something called the Earth point, which is in the third intercostal space, mostly found in this side, but in a lot of books or a lot of literature, you may not hear about it. So all people, American people eat meatball. That's how I use. American people eat meatball.
I like your things, you got something.
Yes, to remember, because it's a lot of stuff.
That's
So
true. That's
American people, and not only that, American, they're over the right side. The Americans always think they're right.
true.
All
True,
right.
true.
Americans always think they're right. They're over the right side. All right. So American people eat third, right side to the sternum, meatball. Okay.
Yes,
Yeah.
So
okay.
remember that. So if someone says that, they hear, if someone said that, they hear a loud, low, high-pitched murmur sound, then, and they hear it in the fifth intercostal space, right mid-clavicular line. I'm sorry, that's as a fifth intercostal space, and that is left, sorry, left of the sternum, left.
Sure.
Then
Okay.
that is considered a mitral valve regurgitation. So remember, mitral valve regurgitation and systole and aortic stenosis. Remember Mr. Ass. Mr. Ass, mitral valve regurgitation or aortic stenosis. What would differentiate if it is, what do you think will tell you if it is mitral valve regurgitation or aortic stenosis? What will tell you what it is? It will be based on where you hear the sound.
I was about to say the location. Yeah.
Location,
Sure, the
correct.
location.
Location of the sound. All righty. Now look at this. Now this is Miss Hard. Now here's why I say Miss Hard. I wanted to, don't miss this. Mr. Love Ass. Okay? So that's why it's Mr. Ass, because Mr. Love Ass. Men love ass. Miss Hard, woman loves hard. So don't miss that. Women love hard. So it's Miss Hard and Mr. Ass. It's important that I know, it's important that you understand this technique in order to get that part correct. So Miss stands for mitral valve stenosis.
That is opposite. Okay.
Yes, opposite. No, it is not regurgitation anymore. It's stenosis. It's going to be same place in the fifth intercostal space, left side. But here's what's going to make it different. It's heard during diastolic.
So that would be low pitch, low pitch.
Yes, low pitch. Not only that, the D stand for diastolic. The D stand for diastolic. So it's low pitch diastolic rumbling, best heard in the apex of the heart. So here's my question to you. I want to say, welcome, Christina Brown. Hi. Here's my question to you now. How would you differentiate mitral valve regurgitation from mitral valve stenosis?
I think the differentiation should be mitral M half should be high pitch and is stenosis is not sorry, what is it called? It's not diastolic. It's I'm sorry, I forgot the name, but
Systolic.
Systolic, yeah, systolic. So, and is the high pitch. So the mitral stenosis is the low pitch and it's diastolic.
Yes, and it's diastolic. So that's a good way to remember it. So Mr., once you see Mr., he love ass, have an S, you know it is systolic. Once you see Miss or hard, D, you know it's diastolic. All right. So with, look at this, AR, look at this, AR, aortic regurgitation. You're going to hear a high-pitched sound, but you hear it during diastolic. All right, and you hear it, the locations remain the same. The locations remain the same. The difference is, do you hear it during diastolic or do you hear it during systolic?
Okay.
All right.
Okay.
Now, here's another step. They grade the murmur, meaning that is it grade 1 murmur, grade 2 murmur, it goes up to grade 6. And it's good for you to know. You need to know what grade murmur it is. Here's what they say. For grade 1 murmur, it is very soft. Murmur is heard only under the optimal condition, meaning that you can very barely hear the murmur. For grade 2, this is mild to moderate loud murmur. Grade 3, it is a loud murmur that is easily heard once the stethoscope is placed on the chest. So if the nurse, if you can put the stethoscope on the chest and you can hear the murmur loud, then it's a grade 3. Now, sometimes students have challenges knowing the difference between grade 3 and grade 4. Now, it's a louder murmur. Here's the difference between grade 4. It is the first time that a thrill is present. A thrill is like a palpable murmur. What that means, you can, and I'm going to say this, even in dialysis, when someone has a port, once you put your hand in it, you can feel, remember, you feel thrill, all right? You don't listen to thrill. You know, when you're thrilled about something, it's an emotion, you feel the thrill. So in this, it's the first time that a person can actually put their hand on the person's chest and feel the turbulence of the blood going through the heart. So that's the difference between grade 3 and grade 4. In grade 3, they can put the stethoscope on the chest and they hear the murmur loud. In grade 4, it is louder, and that's when they can feel the thrill, all right, or palpate the thrill. Here's step 5 now, or grade 5, very loud, and they can hear it with the edge of the stethoscope off the chest. So the thrill is more obvious. And in grade 6, the murmur is so loud that you don't even need a stethoscope. The thrill is easily palpable. So know the difference between 1, can barely hear it. You have to be, very skilled and optimal condition to hear it. 2, very mild to loud. 3, that's when you put the stethoscope and you can hear it. 4, this is when you've actually very loud and you can feel the thrill. 5, very loud with the stethoscope edge off the chest. And then 6, it says that the murmur is so loud that it can be even heard with the stethoscope off the chest. And the thrill is easily palpable. All right? All righty. So by going through that, I've already explained to you why B was the answer. So for question 1, B was the answer. All righty. So look at this. This is question 2. The nurses care for a client who was successfully resuscitated from a pulseless dysrhythmia. Which of the following assessment is critical for the nurse to include in the plan of care? So the nurse is caring for a client who was successfully resuscitated from a pulseless dysrhythmia. Which of the following assessment is critical for the nurse to include in the plan of care? Already urine output, white blood count, blood glucose every 4 hours, temperature every 2 hours.
Can we start? Let me start omitting. Can we try that? Can we start?
Sure. That's a good way.
All right. So this person was basically in cardiac arrest.
Mm-hmm.
Right. So I wouldn't really be too concerned about infection.
Okay.
All right. So I'm assuming I'm gonna omit B.
Okay.
And D, because both of them have to deal with infection.
Okay.
That's my rationale for that.
Mm-hmm.
I want to put. I'm gonna go with A, and this is just going off the.
Okay.
I'm gonna go with A.
What do you say? What do you think, Olanke?
Yeah, I may go with A too, but I'm doubting maybe it should be C, but let me go with A.
Okay. So the answer is A. So I wanna look at it at a practical point. What it means is that this person didn't have any pulse. That means, remember that the heart is the pumping mechanism, right? It's the heart contracting that create the pulse. So when a person have no pulse to push the blood out to the body, when a person have no pumping mechanism, there is no pulse. However, this person have a dysrhythmia showing. No pulse, no blood flowing, mean no urine. The urine output will tell you or indicate what the blood flow is like or the fluid volume is like in the body. Sorry. So the correct answer is urine output, hourly urine output. All right, the blood glucose at this time does not matter. Maybe later on, but we're talking about fluid. That's the blood circulating in the body. So this is we're talking about perfusion. So let me get this off and let me clear the drawing here and get back my mouse. So already urine output, the client who has had an episode of decreased glomerular perfusion or at risk for pre-renal failure. This is caused by an abnormal decline in kidney perfusion and reduced glomerular perfusion. Pre-renal failure occurs when the effective arterial blood volume falls. Examples of this phenomenon include a drop in circulating blood volume, as in cardiac arrest states or in low cardiac perfusion, stated such as congestive heart failure associated with cardiomyopathy. So close observation for hourly urine output is necessary for early detection of this condition. So what in your case, I would go look up, this is talking about resuscitation, it's talking about pulseless dysrhythmia. So if those points that you're not strong in those points, then you would, after doing your quiz and you're doing your remediation, then you go and look up, okay, what it will look like on the strip. What is the intervention for these individuals who have pulseless dysrhythmia? So I put this question in because it is digoxin and Lasix, and it's actually used for people who have congestive heart failure. So a provider orders digoxin 0.125 milligrams PO and furosemide 40 milligram every day. Which of these food would the nurse reinforce for a client to eat at least daily? Spaghetti, watermelon, chicken, or tomato? And you're going to see these questions, believe it or not. You're going to see questions in the NCLEX that talk about a sandwich, like a burger with vegetables and tomato and fries, rice with chickens and beans. And these questions will be, you will see this question, I guarantee you, in the NCLEX.
Can I go for watermelon B?
Okay.
B, because it's PO. What
do you think, Jeremy?
Yeah, that's the only one I was looking at that actually looked good to me.
Okay, but why were you guys thinking watermelon?
I'm thinking about the I know watermelon has a lot of water in it.
Okay. Okay. So here is one of the things with this is that when someone is on digoxin and Lasix, it actually loses, for the diuretic, they lose potassium.
Potassium. I didn't know I had potassium. That's actually good. I didn't know I had potassium.
They actually lose potassium. So then they want food. So here's what I'm going to ask you guys to do. I'm going to ask you guys to go look up foods that are high in potassium. First time, early on in NCLEX, banana was it. But they find out that everybody knows that potassium is high, banana is high in potassium. So they're not putting banana on the test as an answer. So there are other foods like, yeah, because first time was banana. Remember banana, and banana has a lot of potassium, but you have baked potato. But baked potato with skin have about 950 milligrams of potassium inside there.
Wow.
Then we have sweet potato. Sweet potato with skin have about 450. Beans, soya milk, and all of those other things. So make sure that you know what foods are high in potassium and what foods are low in potassium. Because they will ask those on the NCLEX, so you need to know. And they're not giving you bananas anymore. So foods, even foods like rice and beans that are high in, if someone is a vegetarian, if someone's a vegetarian and that person are not only a vegetarian, but don't eat meat and then eat protein, rice and beans come together, complement and give you enough protein for someone who does not eat meat. So these are some of the things that you guys need to know because they're going to ask you those. All right. So look at this question. A nurse is assigned to care for a client who had a myocardial infarction 2 days ago. The client has many questions about the condition. What area is a priority for the nurse to discuss at this time? Daily needs and concern, a review of cardiac rehabilitation, medication and diet guidelines, activity and rest guidelines. This is like a management of care question.
So this person had a heart attack, and in a heart attack, you have death of the heart tissue. All right. So once that happens, what's the most important thing you want the patient to be doing after the fact?
Can I go for C, medication and diet guideline?
Okay, noted.
Yeah.
Go ahead.
C looks the best to me, to be honest.
Okay, so this is one of the common mistakes that students make. One of the things that they see myocardial infarction, and that's the only thing that's stuck in their mind. But I want you to read it. It said the client has many questions about his condition. The client has many questions about his condition. What is your priority? So look at this. Let's act this out. I'm going to knock on wood. Jeremy, you're the patient, right? And you asking me, you have a lot of questions to ask and a lot of things you want to know about the disease and what's going on. And I come and say, I want to discuss with you diet and so forth. I am not addressing your needs. You have a lot of concern. What is the daily needs and concern? What is your concern? That's a priority first. So one of the things is you have to look at the question and what it's asking. So most of the time students see myocardial infarction, oh my word, let me address what's going on with the myocardium. Remember that this patient had it 2 days ago, and that's what you have to look at. So this person is stable. This person is not in an acute attack. If they were having the myocardial infarction right now, chest pain and all of that, and the cells are dying at the time, then physiological need will take over. But this person is 2 days ago. So now they want to know, okay, they have a lot of questions to ask. So you have to address their question at that time. So you get what I'm saying? So depending on what the question is asking, 2 days ago, patient stable, he has a lot of questions to ask, that's a priority. Whatever question the patient have to ask is a priority at that time.
Daily needs and concern.
However, if a person was having an active attack right now, then that would be a different case. All right. So daily needs and concern at 2 days post-op, the client education should be focused on the immediate needs and concern for that day. And that's what, when you're prioritizing people, that's why a lot of times you hear people say ABC. It is not always ABC. And airway breathing circulation is not. Here is why it is not. If you have, let me get my pencil and this is what they're talking about when they're talking about critical thinking. So you have patient 1 coming with respiratory. What can I write with my finger? Respiratory problem. Respiratory issue and difficulty breathing. Four days ago, okay? 2. This person coming with chest pain. Three days ago. This person coming with pain 2 hours ago. All right. And this person come out of surgery 6 days ago, 6 days post-op. Who would you see first?
Pain 2 hours.
I'm sorry?
Pain for 2 hours.
Okay, noted.
Because respiratory difficult breathing for 4 days, for the person to survive it for 4 days, that means it's not priority, or it can still survive it. They are trying to manage it and it can be manageable. And for chest pain for 3 days, 3 days is not a 24 hours, it's not 48 hours. So 3 days is over 48 hours. So surgery for 6 days, that is the long days. So I think someone that came in for pain for 2 hours, because 2 hours. So I think that's my.
Okay. So that go ahead, Jeremy.
Oh no, about you. Okay. The first one, what's that say? That says 4 days, the first one?
Yes, respiratory and difficulty breathing 4 days ago. They were admitted 4 days ago.
Okay.
So your explanation is right. And the reason why I want to point this out, it's not always A, B, C. And a lot of students get caught in that. Because you're going to see respiratory difficulty breathing. Whoa. But that's 4 days ago. That person, even though I didn't give a lot of information, that person is stable. That's 4 days ago. Same thing for the chest pain. The person who having pain now, the pain may be simple, but it's 2 hours. So you see that person's a priority. So when it comes on to prioritization, what I want you to know is that based on what's going on, physiological needs, and the person's physiological needs supersede psychological needs. What do I mean by that? If someone is bleeding out, can't breathe, or some bone is broken or something, that takes place over someone's psychological problem. All right? That's what I mean by physiological needs supersede psychological needs. In addition to that, whatever is important to the patient is a priority too. So that's why when the question said that, this person have a lot of questions that they have to ask, addressing their, and they said, what would be a priority? You need to know that whatever concern that the patient have is a priority. They're out of the danger in a sense right now from the MI. So whatever question they ask or have to ask is a priority. All right. Okay, so let's do one more question. So in this question, the nurse admits a 5-month-old who vomits 9 times in the past 6 hours should observe the signs of which overall imbalance: metabolic acidosis, metabolic alkalosis, some increase in serum hemoglobin, a little decrease in serum potassium.
I'll pick B because it's concern of vomiting, because of vomited like 9 times. So I think B and metabolic alkalosis always cause that is the symptoms of. So I'll pick B.
Okay. Jeremy, what do you think?
You know, with your questions, I gotta read them nice and slow because I know
Okay,
you got some
all right. Take your time, take your time.
Yeah, I just want to take a little, you know, let me see.
That's okay.
5-month-old, 5 months, sorry. Ooh, vomited 9 times in the past 6 hours. B looks good.
It is B, metabolic alkalosis, because one, it's metabolic, it's vomiting. Alkalosis is because the stomach is very acidic. And when you vomit, or you're getting rid of the acid. So getting rid of the acid, you have less acid within, so you become alkalosis. And listen, that is fine. If it is an answer, it is an answer.
Yeah,
So
yeah.
Alkalosis, vomiting causes a loss of acid from the stomach. Prolonged vomiting can result in excessive loss of acid and lead to metabolic alkalosis. Findings include irritability, increased activity, hyperactive reflexes, muscle twitching, and elevated. So option C, D are correct, but not the best answer since they are not, because they are too general. So I wanted to do, let me see. Let's do this one. A couple more minutes left. A 2-year-old child is brought to the provider office with a chief complaint of mild diarrhea for 2 days. Nutritional counseling by the nurse should include which statement? Place the client on clear liquid and gelatin for 24 hours, continue with regular diet, and include oral rehydration fluids. Give bananas, apples, rice, and toast as tolerated. Place NPO for 24 hours, then rehydrate with milk and water.
Is brought to the provider office with a chief complaint of diarrhea for 2 days. Neutralization counseling by the nurse should include which statement? Place the child on clear liquid and gelatin. No. Continue with the regular diet and include oral rehydration fluid. Regular diet. Give banana, apple, rice, no. Place on egg, no. That's a 2 years old.
I think I have this one. I'm looking at the mild diarrhea because it's not severe, so I'm looking at that word mild. So because it's not severe, and it's still diarrhea, so I'm just gonna go with B, but not sure. That's just
okay. All right.
The mild diarrhea for 2 days, and you want to rehydrate, you know, obviously.
Okay, thank you. Olaniki, what do you think?
Yeah, the reason why I'm gonna go for B is because diarrhea for 2 days
is not that much, and it depends on the quality or quantity of the diarrhea, because regular diet, yeah, fine, and include over rehydration fluid. I think that should be fine,
Yes,
though.
both of your rationales are good. So continue with regular diet and include oral rehydration fluids. Current recommendations for mild to moderate diarrhea are to maintain a normal diet with fluids to rehydrate. So that's correct. So, all righty. So some tips. Here's what I'm going to say to you guys. Please make sure that when you're practicing your questions, when you look in the answer choice, like we did just now, and we saw murmur, if you see something in the answer choice that you don't know, go look it up, because you're going to buck it up again in your studies, all right? And make sure it's going to take you 5 times the time that you take to take the test longer for the remediation, and that's okay, because that's the way it's supposed to be, all right?